Hello, friends. Welcome to the Ancient Health Podcast. I'm your host, Dr. Chris Motley. Today, let's talk about vertigo. Have you ever had vertigo or felt that the room was spinning around you or that you were spinning? There are some differences in terminology, whether you're dizzy or have vertigo, but anytime the world is unbalanced or you feel like you cannot stay steady, that is quite a debilitating issue, a concern. Things can go well in life. You can have some aches and pains. You can have some severe pains in the body. But as soon as vertigo comes on, that is the most debilitating aspect or hindrance in a person's life. You can't drive. You can't walk steadily. You're afraid to try to walk across the room because you're afraid you're going to fall. This is something that needs to be addressed because in the clinic, I see patients that have vertigo many times during the year. And when I do see them, I always recommend that they go to the inner ear doctor and get an audiologist to check out what is going on in the inner ear and in the brain if they have to do a CAT scan. But in my world, I do always recommend the Western medicine approach. But I always look for chronic infections and chronic instability of certain organ systems that could lead to ear issues that could cause vertigo. So I want us to look at vertigo in its relationship to chronic sinus infections of the head, in the glands around the eyes and around the ears. We want to understand that infections such as chronic streptococcus, staphylococcus, E. coli, and H. pylori have all been documented and have been known to transverse up through the areas of the head into the sinus glands and even into the brain. These infections, if they're left untreated, could create quite a big amount of neurotoxins, and this will increase inflammation and at times can damage brain tissue, i.e. damage nerve tissue, inner ear nerve tissue. There is a relationship between chronic infections in the ear canal, in the tubes of the ears, and the apparatus of the ear, and the hearing loss, tinnitus, and the vertigo. I'm not saying it's the only thing that causes vertigo. In fact, this is just one of the many things that could cause it. But if you're at a loss and you have vertigo, please check into chronic infections of the glands of the head, the sinuses, and even the lymph nodes. So we're going to discuss this and recommend the labs such as MicroGen DX that you hear about me talking all the time. They'll be in the show notes. And also drawing blood to check for viral infections. And in fact, viral infections are known to be more injurious to inner ear issues than bacterial. I find them both in my practice when I check with frequency testing. But viruses such as old shingles, varicella, herpes virus, herpetic virus like Epstein-Barr virus, cytomegalovirus, herpes simplex virus, human herpes virus 1 and 2. These viruses are often associated with damage to the nerve that's in the inner ear that travels to the brain and helps keep you balanced. And we're going to talk about the details of that with the inner ear hairs. Now, we need to look at the viruses and get those checked out. You can go to Vibrant Wellness or vibrantamerica.com. The lab has a really good test for common viruses. They have the common herpetic viruses. And even flu virus has been known to damage the nerves to the brain from the inner ear. So we want to check on those infections. We want to talk about the supplements that I really love. I really love the supplements of Malia, which is neem. I love woad, which is Chinese isotis. It's WOAD. I like golden thread supreme, which is Chinese coptis. And I really love astragalus. Astragalus is Chinese medicine's antiviral, antibacterial immune booster. And taken that during the cold winter months on a consistent basis can literally kill off viral infections and raise your immune so high that you strengthen your own nervous system, your own immune system to go and fight off these infections that are hurting the nerves. So let's discuss those herbs. And I really don't want to forget how we use red light therapy or violet light therapy to actually clean off the infections. Because if you see many of the products out there, you have to be very careful because some products are just put together cheaply and they are not put together well. But there are some products that if you do your research, they have really good information about how they are sturdy and they actually can use light to use frequency and wavelength to go in and help clean up and kill off infections that are deep within the tubes of the ears and around the ear, where many times it's hard to get the herbs from what you take in the body to reach in those areas because they're so clogged up. So let's talk about first, we're going to talk about the apparatus of the ear. So when we're talking about vertigo, in Western medicine, we often refer to otoconia, which is the inner ear crystals. Now, the inner ear crystals are very, very small. They're small crystals that are in the inner tubes or semicircular canals or near those, near the inner ear. And so they have a labyrinth and they have a vestibular apparatus. And these are the apparatuses of the ear where there's these small crystals that are placed in high amounts. There's about 1,000 of these crystals in each ear. And they're very small and they help you to basically keep balance. The shifting of the crystals actually stimulate the hairs within the ear canal. So I'm not a vestibular or an audiologist expert, but we had to study this in neurology where you have these tubes that run in your ears and you have fluid that's in the ear in these tubes. Now, these tubes in the ear, many of them have these small hairs. Yes, hairs. And the fluid movement and the movement of these crystals can stimulate the hairs and they stand on end. And when they stand on end, if you can imagine, guys, like the hair standing on your skin, those hairs will trap frequencies. And this is one way that the ear actually records frequency from the environment so you can hear. But the crystal formations in the ear actually stimulate the hairs as well. It stimulates the hairs so that it actually will stimulate the nerve that goes to the brain. So the crystal position within the ear stimulates the hair in such a way that it will tell the hairs basically what position the head is in. And those hairs are so sensitive that they actually are standing up and leaning over on in, and it's almost like a gyroscope. They can tell your head or tell your brain what position you are in. So the shifting of the crystals back and forth or forward and back, they will then stimulate your brain. So do you guys understand and see that picture? You have the crystal stimulating the hair. The hairs are in a certain position from the crystal stimulation, and that will send through the inner ear nerve up to the brain to tell your brain what position you are in. Are you level with horizon? Now, if those crystals get out of place, according to Western medicine, and if you suffer from vertigo, you understand this, but if the crystals are out of place and they're shifted out from a concussion, an old car wreck, from an old injury, the shifting can actually dislodge the crystals in a certain way that it's stimulating the hairs in a concentrated area or in the wrong area, so that the hairs are stimulated in the wrong way and they send an imbalanced signal up to the brain, causing vertigo. So I know that audiologists have a much better explanation and a much clearer explanation, but I want you to know that when they talk about inner ear crystals, it is a real thing. And it can cause those types of conditions. And you can use certain movements that they teach you with PT. And there's new movements and new techniques out there that help with the bouncing of the ear crystals. But if you can shift the crystals back into the right position, if you can shift them around so that they're not concentrated in one area of the canals, then you can actually get the person out of vertigo. Now, the other thing I want to recommend is this. Infections when you're young, such as strep, staph, any form of chronic bacterial infections like E. coli or salmonella, have been known to create problems in the body. And those infectious microbes and toxicities that are in the sinus glands, that are in the throat, like with mono, that are up in the gums, or if it's a chronic nasal passage issue, those stick around in your sinus cavities and in the tubes of the brain, because you have these small areas of the brain that are pockets, they're ventricles, and they're used not only to help you think and make the brain work properly, but these small areas called ventricles are areas that the body will use certain fluid like mucus to clean out the brain. Not only is it the transfer of neurochemicals, but you have to clean out the brain. And now they've shown that there's lymph glands and there's sinuses within the brain to try to take pressure off the brain and actually use them as a source of immune function to clean the brain. That's what your sinus do. They're protective. So if you have the infections in your sinuses or in your ears, you have the tubes, the eustachian tube from your sinuses in the frontal area, underneath your eyes, guys, and it's traveling all the way back to the ears. So you can get an infection in the nose, like a strep infection, and if it gets cultivating within the sinus glands underneath the eyes or above the eyes or on the side, they can basically connect with each other, all these sinus cavities, and there's a tube that runs right back to your ears. And so people will get ear infections because the sinus infection from around the eyes traveled there. So if you had a chronic infection when you're young year after year, if you had mono year after year, if you had strep months or many times in 1 year, and it happened consistently when you were young, and you started to get out of it, many times we think it's done and over with, that we don't have any more infection. If you didn't take an active role trying to cleanse those things out of your body or increase your immune system, they usually have stuck around and gone dormant. That's how people can be a strep carrier and have high markers of antibodies in their blood, but they have no symptoms. They have symptoms on minute scales. They do. So with this, we have to pay attention that we need to clean those infections out, because if you had a recurring infection, it's basically going to get to the ears, possibly, and damage the nerves that go to the ears or go to the brain. So what I have seen with patients is that each time a vertigo patient has come in, and I can almost say 100% of the time, I always ask if they had chronic sinus infections when they were a kid, chronic ear infections, or chronic throat problems like strep throat. And I'm going to say almost 100% have all said, yes, I had multiple strep infections or bad sinus issues all my life. The infections get on the nerve and can actually cause high amounts of inflammation to the nerve, which leads to oxidation, and that can damage the nerve, like rusting the nerve. So there has been so many reports and studies that have shown that there are presence of infections on the inner ear and the labyrinth and the vestibular apparatuses, where things such as shingles, shingle viruses, herpes viruses, and flu viruses are very, very prominent, where you can have fluid buildup behind the eardrum. Now, they then can damage those small hairs, and they've said that there are certain strep and staph that actually eat away at the hairs in the ear, the ones that actually are stimulated by the small crystals. If they're damaged, that means that can give you tinnitus. If the hairs cannot be stimulated by the crystal formations because they're damaged or eaten away, that'll give you vertigo. So you can have tinnitus with vertigo if the hairs are damaged or if they're eaten away. So what I have seen with the patients with vertigo is after they get their testing done, I recommend that they get every test that they can get done, because if the hairs are damaged to a very, very heavy extent, it's tough to get them out of full tinnitus. And I'm not sounding, negative. I want you guys to know that you can really definitely help tinnitus. But if it's damaged hairs, it takes a longer time. In fact, with tinnitus, I do first send my patients over to Dr. Tyler Hurst, who's a neurological-based chiropractor here in the Nashville area. And the reason I actually recommend him first for tinnitus is because I want him to do all the neurological testing that needs to be done to see if the nerve that's going into the brain from the ear is actually working properly. Which means you need to find a neurological chiropractor. That's what they call neurological diplomate chiropractor, or the neurologist of your choice, to do active testing to test the cranial nerves to see which cranial nerves are tracking properly. Those that have to do with the eyes, the hearing, the smelling, the tasting, the facial expressions. So when they go to get it checked, Dr. Hurst can tell them, okay, this ear nerve is damaged. It's operating at 40% or 50% or 70%. That way, I then get an idea of how severe the tinnitus is, and then I could use the way I help clean up infections to see if we can get them up to 80% or 90%. But I am realistic. I tell the patient, tinnitus can take me 8 to 10 months to start making a big dent in it. But with the help of a neurological chiropractor, you can make leaps and bounds, because you can do exercise, even with light, sound, and vibrational stimulation on the body, in the brain, through the hands, feet, through just watching neurologically stimulating graphics on a computer screen. You can use those to start to retrain the nerves in the brain. I also recommend neurofeedback. There's many types. I like Lenz Oaks, OCHS, Lenz Oaks therapy. I use that with neurologically based chiropractic maneuvers, and those start to help the nerves to communicate with the brain properly. And then after they go to the audiologist, they get those things checked out in the ears. I myself use frequency and biofeedback testing to see if there's the infections. Now, I love to use lab testing, and the lab testing that I like to use is going to be MicroGenDX, and you guys heard me say Vibrant America or vibrantwellness.com. But if you get the infection information, at least you know where you're at. And if you had heavy strep infections from all those old infections, you then have a baseline and know I have a lot to go through, or I have a little bit to go through to clean out these infections. So if there's a lot in your head, I always tell the patient, you got to give me 8 to 10 months. I like to see results in 3 months, 4 months. But I'm realistic about how much infections can try to hide. So you have to use the shotgun effect, as I refer to many times, to use different herbs to help clean out the infections. If you clean out the infections, you can stop the damage to the hairs, the small little hairs, and the crystal formations within the ears. You can stop the inflammation and the swelling and the fluid buildup in those ear canals. And if you get the ears to drain properly and the sinuses to drain properly, you'll start seeing the healing of the nerves in the ear and into the brain. It can happen. I've seen it. Nerves can heal. So once I started to clean out the infections with the patients I've had with tinnitus, I've noticed that they'll say there could be fluctuations up and down because layers upon layers of infections can build up over the years. So if you had tinnitus for a long time, or had vertigo for a long time, or had the strep for a long time, those infections can replicate and get in high amounts. So you have to be a bit aggressive with them. So what I try to do is when I start to clean them out, I make sure that I tell them you could have much sinus drainage after we start cleaning you out. You could have inner ear itching. You could have high wax buildup. In fact, patients that have done this have told me they pulled out huge pieces of earwax, or they keep blowing out mucus and snot consistently weeks after we start cleaning out the sinuses. But it's a good feeling to get it out. So I use different herbals. Now, I don't get supported by this company, but I use them all the time. So I'm just going to show you guys. If you guys can see me on camera, or if not, you're listening today. I like Woad Supreme. Remember, I've mentioned this. Woad Supreme by Supreme Nutrition Products. I like Golden Thread. Golden Thread, if you can see her on the camera. Malia Supreme and Astragalus. Now, I keep these here so you guys get an idea what they look like. Now, when we use these here in the office, I don't use all of them at once. In fact, what I do is I start to take one and I'll muscle test to see which one works the best for that person at that time. And sometimes I get 2 herbs. And I'm a little more aggressive as I gotten older. I will sometimes give 2 capsules of each. I'll take 2 of the supplements and give 2 capsules of each every day. And I will then start to wait for about 2 to 3 weeks, and then I may switch over to the other 2. Now, if I ever get a negative muscle test with one of the supplements, I don't let them use that. Anytime a supplement makes you feel too itchy or makes you have decreased bowel movements, if it affects your sleep in a negative way, or it affects you where your energy is very, very low, like low in the sense that it's very negative. There's times when you get toxic and you don't feel like you can move out very well after taking a supplement. But if you take something like that and it causes changes in your poop, your sleep, or your energy in a really negative way, then I discontinue it. So with these, I will do a shotgun effect. And the folks at Supreme Nutrition Products, you can go on there and you can read what each herbal does. And there's many types of herbs that help with strep and staph, not just these. These are my top for me that I've seen work really well. Now, can these work with kids? Yes, they can if you get liquid forms. And there are some other brands like Woodland Essences, Woodland with one word, essences.com, that have a lot of these herbals in a good tincture form. And you can use that for kids, or you can take them and open them up and stick them in, some unsweetened applesauce or some good plant-based yogurt and give it to the child and see if they can take it. And it can work really, really well. Because children get vertigo. I've had that happen over the many years. So cleaning out the infections in the ears, using the proper lab testing, can start to drain all this infection and crud out of the body. One thing I probably should have put in the show notes is you need to also look into assisted lymph therapy. Assisted lymph therapy actually helps clean up the lymph around the ears. And as you clean up the lymph around the ears, it helps it drain properly. And if the lymph nodes drain properly around the ears, then the crud can get cleaned out. And you use a small static wand that literally goes in and uses static electricity to help with loosening the congested lymph nodes. So if you have lymph nodes that are, bulging, that are lumpy around the ears, if you notice you have huge swelling around your mastoid, the bone behind the ear, get assisted lymph therapy to drain and flush those lymph nodes around the ear out. This will allow the infections to drain out properly from the ears. The next thing is if you get the assisted lymph therapy, is always look into proper cleansing of the bowels. I always recommend either a colonics or coffee enemas. So you have to make sure that you get the bowels and liver cleaned out. And I think it worked really well. For kids, you'd have to discuss with your primary care physician for them. But I would say even for adults, really look into the coffee enemas. I can't be a bigger proponent. It helps so many of my patients, especially with clearing the sinuses and the upper congestion of the throat and the head. Assisted lymph therapy, and I love red light and violet light therapy. There are many devices out there, and there's some that are very reasonable. Now, I use AvantWellness.com. It's a really good laser. It's very expensive. But I say if you can read that technology, but look into different devices. There's many out there that I like, but the red light industry is really, really very, very strong and very big. But I like biolite.shop. And that's my good friend, Dr. Mike Belkowski. I do like TheraSage too. I think that there are different devices that help with red light therapy. And I know that they are honest people, and you can look into their devices and see if you can use red light as a light therapy on the head, on the face, to help break loose those infections of the sinus glands into the head and neck. So look into those companies. Check into avantwellness.com and see if you can find any devices that are similar to that, or if you want to buy one. But I'm telling you, it has worked wonders by putting the light therapy, violet and red light, into the ears and drained those infections out. I then add in some bounding, make sure the person does some bounding on a rebounder. And with the herbs, the therapies all mixed together, I would say get the daily or the weekly or monthly checkups by your ear doctor and see if you're making progress by cleansing out the head. If they're not finding anything in the sinuses, get a thermography specialist to use a thermogram to see if your sinuses are completely inflamed or cold. That's another way. If you can't find anything, get a thermography and then do the assisted lymph therapy. This can help clean out the ears, can clean up the sinuses, get the neurotoxins out of the body, out of the brain, so it's not overstimulating the brain. And this can cause the vagus nerve to be overstimulated. The vagus nerve is overstimulated because the organs, the sinuses are fighting all the time infection. That vagus nerve is sending relaxation signals where? Around the neck, down along the carotid. And if it's consistently working, it'll wear out. It can't keep you calm anymore. This causes the neck to lock up where the area around that nerve is injured and starting to get inflamed around the carotid. And you start to get a congestion of all that fluid and lymph in your head because that vagus nerve got worn out, and it caused all the muscles on the front of the neck to tighten up. So we have to clean out the sinuses so we bring the vagus nerve out of fight or flight. That's why I like neurofeedback. That's why I love using the chiropractic neurologist to help reset vagal nerve tone. Use all of these together to help bring cleansing to the brain and to the head and to the ears so you can get out of the vertigo. These are some simple steps, but guys, it can really help. It can really help you. Guys, let me know if this has helped in any way possible. If you have any other questions or suggestions, send me a question, send me a comment on this podcast. And I'm really glad I can help in any way. But like and subscribe if you think this is the information you want. If you have any other aspects you would like to hear me talk about, put it in the comment section. I really want to know. Guys, let's try our best to clean up the head, to clean up the vertigo. And until next time, I hope every one of you have a great night, a great day. Talk soon.